I'd like to show you my mouth here so that there's no confusion. When we talk about the spot, we are talking about the spot here on the roof of the mouth behind the top teeth and the central front incisors. So where that black star is, that's the spot that we will be referring to. These stretches are only to prevent reattachment. These do not replace what your provider has prescribed. Do the tongue stretches even if your child does not want to do them. If your child resists doing the stretches, do them anyways. Once they know they are going to happen, they will calm down and may stop fighting them. The wound as it heals will turn white and a little yellow. The first day will be the sorest. If you are concerned about pain, please discuss this with your provider when you have the procedure done. These are basic tongue movements that will be shown. They're to help with healing of the release. Always consult with your provider or specialist before utilizing these movements. They may prevent reattachment. Many have reported that the more the tongue moves, the better it feels. Lift the tongue tip behind top teeth on the spot. This is the star that you saw on the giant mouth. Open your mouth wide as you can and hold. You will hold the tongue on the spot for 3 seconds 10 times. Do this 5 times a day. Be careful not to jut your bottom jaw forward when you do this. Similar to the previous exercise, lift your tongue tip up, but put it on the front of your top teeth or top lip. Hold the tongue on this area for 3 seconds, 10 times, 5 times a day. Be careful not to jut your bottom jaw forward when you do this. Suck on a small candy. The flatter the candy, the better, to allow more tongue elevation to the roof of the mouth. Take a flat lollipop. Hold the lollipop in front of your mouth and lick it up and down, only moving your tongue. Be careful not to move your hand up and down or to move your head up and down. Take the lollipop and put it at the corner of the outside of your mouth. Take your tongue tip over to that side and lick it. Repeat 5 times. Do the same on the opposite corner of your mouth. Be careful to hold your jaw stable. Do not slide your jaw. Take the lollipop and put it on your lips and lick the lollipop off by doing circles across the bottom lip, the top lip, 3 times, and then repeat in the opposite direction. Tongue twists. Take your tongue, stick it outside of your mouth, and do lateral tongue twists. Move tongue side to side with mouth held wide open. Do not move your jaw while doing this. Move your tongue to each corner of the mouth. Repeat 10 times, 5 times a day. Tongue clicks. Do tongue clicks by bringing the middle of your tongue to the roof of your mouth. Then release by suctioning your tongue and making a clicking sound. Do these fast and do these as slow as possible. Next, as you move from doing a very slow tongue click, freeze right before you let go of the suction. This is called the cave or the hold and pull. Put your tongue on the gums behind your top front teeth. Bring the middle part of the tongue to the hard palate. Hold your tongue on the hard palate while opening your mouth as wide as you can, suctioning the tongue against the roof of the mouth and lowering the floor of the mouth as low as possible. Hold 5 seconds. Do 5 times a day. Open mouth wide. Point your tongue and stick it out, keeping it off both lips. Next, bring your tongue in and repeat, in and out, 10 times, 5 times a day. Next, similar to the previous movement, when the tongue comes in, have it go in and go to the spot. When the tongue extends straight out of the mouth, have the tip go up. Repeat 10 times, 5 times a day. Cracker chew. Use some cracker of your preference to chew in your mouth. Chew it smooth until it forms a ball. Collect the ball onto the surface of your tongue. Stick your tongue way out as far as you can beyond your lower lip, trying to touch your chin. Pull the tongue way back towards your throat. Curl the tongue way to the left inside the mouth. Some people call this the tongue poke. Do the opposite side by curling your tongue way to the right, poking the other cheek. Lick your hard palate or roof of your mouth with the tip of your tongue. Start behind the center of your top front teeth and follow the middle of the roof of your mouth as far back as possible. Bring the tips, both of your pointer and your index fingers together and slide them under the upper lip on either side of the central release site. Lift the lip up to fully expose the entire wound. Hold the lip up for a total of 5 seconds. Do this once, 5 times daily for 2 weeks. Now, take your index finger and rub gently across the wound site. Bring tips of index fingers under the tongue with the pads of your fingers firmly pressing towards the base of the child's tongue. Your fingers should now be directly on either side of the frenotomy site. Now stretch tongue upward and backwards towards the roof of the mouth to open up the diamond-shaped frenotomy site. Hold this position for a solid 5 seconds, 5 times daily for 2 weeks. Now take your index finger and gently press onto the wound site. Rub side to side for a few strokes. This will take about 5 seconds. Take a piece of gauze or paper towel and place over the tip of the tongue. With your index finger and your thumb, hold the tip of the tongue and lift inside the mouth until you feel resistance. Hold for 5 seconds. With the goal of moving the tongue, dip a whisk into something you like to eat. Hummus, whipped cream, ice cream, yogurt, anything with that type of consistency. Lick it off of the whisk with your tongue. Move it in and out, up and down and around the whisk. You can also lick the beaters from a mixer with something you like to eat on it. Fill a shot glass or kid's medicine cup full of food and lick it out only using your tongue. Avoid forward and side-to-side movements of the jaw. Rule of thumb: do not make tongue movements by using other body parts to assist. Repeat these stretching exercises 5 times per day for the first 2 weeks, unless otherwise specified by your provider. Do not go more than 6 hours between these movements.